as officials report a $1.5 million windfall over the first 2 days of 2022. Montana joins 17 other states which have collectively reaped more than $10 billion in recreational marijuana tax revenue since 2014.
We got some legal weed!
Still illegal at the federal level, state-sanctioned adult-use pot has mainly sprung up in the West and Northeast. Though limited in the Midwest, Michigan and Illinois tout recreational industries, with the land of Lincoln boasting an accumulated $500,000 levy since January 2020. By contrast, medical marijuana has soaked deeper into the nation's fabric. Since California first opted to legalize for therapeutic purposes back in 1996, 36 states have followed suit. Proponents just west of Illinois, in Iowa, say progress on the state's medical front has improved since highly prohibitive origins in 2014, expanding from pediatric epilepsy to allow treatment for several other health conditions.
The market really kicked off in Iowa December 1st, 2018. And from there, we've been able to supply products to the various dispensaries across the state from then. We've gone through a lot of changes. We've been able to remove a THC cap that used to be on the program, now allowing full levels of THC in any of the products.
Lucas Nelson is general manager of Des Moines-based MedFarm, Iowa, the state's sole approved cannabis grow operation.
Every single plant in the entire facility has to be tracked in real time by our electronic system and by the state.
Only 5 sanctioned dispensaries operate in Iowa, and MedFarm is currently supplying them all, including their competition, as well as their own locations in Sioux City and Windsor Heights.
The number one thing we see in here is pain, whether that's chronic pain or acute pain.
Dispensary manager Stephen Wilson says many new patient customers have detailed a harrowing journey through a slew of other pain meds. And even though some doctors suggest cannabis before other harsh and addictive prescription drugs, Wilson says hurdles remain for income-restricted sufferers.
I think the most important thing to realize is this is an expensive product that is not covered by insurance. You know, opiates are often, very often covered by insurance.
Currently, state-certified patients must pay up to $100 annually for a medical card authorizing purchase of cannabis products. Just under 8,000 Iowans are registered cardholders, less than a fraction of 1% of the state's population.
The big difference between our program and other programs are the type of products available for purchase.
Acceptable delivery methods include topicals and oral forms, but no edibles. Vape oil, once a restricted item, has quickly become the most popular offering, though Wilson says patients have been pushing for more.
Most other medical cannabis programs are going to have flower. Iowa doesn't currently allow for us to manufacture or sell flower products. If we're able to do that, prices are going to naturally fall.
A half-gram vape mix of high THC and low CBD sets Iowa patients back about $75 after tax, while similar items can be found around 66% less for about $25 per unit in other states.
It's very expensive to operate in this state currently.
56, I am showing a pretrial supervision violation.
Iowa border municipalities haven't reported a significant increase in crime statistics since Illinois began recreational sales, but law enforcement cautions illegal trade hasn't evaporated. Apprehension grew in northwest Iowa when South Dakota voters approved dual-track legalization in November 2020. Though medical remains intact, the governor there successfully blocked recreational implementation. Onlookers expect voters' voices will still be heard.
It looks to us that the legislature in South Dakota will probably still end up passing some kind of a recreational cannabis program anyway.
Dane Schumann is a lawyer who lobbies Iowa lawmakers on behalf of MedFarm, which involves keeping an eye on pot-related developments nearby.
We see the impact that Illinois' program has had on the medical program because we can track how many patients in Iowa's medical program there are within each county. And if you look over at Iowa's eastern border, the amount of medical patients has completely stagnated since January 1 of 2020 when Illinois' program went live.
Many of us have been in that situation where if we're in pain or someone in our family or that we care about is in pain, we'll do anything to help that.
Industry and medical experts believe one of the biggest risks for patients who choose to engage the black market, besides Iowa's zero-tolerance statutes, is product purity.
What you're seeing here is some of our THC oil that's being distilled.
Right now, Iowa's authorized raw marijuana crop must be processed into oil before manufacturing, driving up costs. Nelson says the absorption rate of inhaled products is much higher than other means, and lifting the flower ban would move the state toward a full range of patient choices. Health pundits warn combustion releases volatile chemicals and fumes, but some states offer flower vaping. And Nelson says for the destitute, pain relief benefits may outweigh potential risks. But short of legislative adjustments, MedFarm could be forced to expand into friendlier business climates outside Iowa, sending more jobs and tax revenue elsewhere. It's a scenario Nelson prefers to avoid.
We have no intention of leaving. We're all from Iowa, have connections to Iowa before we started working here at MedFarm, and think that makes us maybe a little bit more uniquely dialed in to understand what this state needs.
For Market to Market, I'm Josh Bittner.